Representative Henderson, Representative Larson, Representative Sherwood, Representative Stith,
Here.
Representative Walters,
I appreciate it.
Representative Swanitzer Dave,
Here.
Senator Anderson, Senator Guru,
Here.
Senator Kinski,
Here.
Senator Salazar,
Here.
Co-Chairman Nethercott. Mr. Chairman.
Thank you. Welcome, everybody.
Mr. Chairman?
Senator Salazar, do you have a motion?
Yes, Mr. Chairman, as a no vote yesterday, I'd like to reconsider the proposal that,
On the public health nursing budget.
yes, Representative Walters.
Okay, there's been a motion on the prevailing side to reconsider that bill. All those in favor say aye.
Aye.
Those opposed? That motion carries. We are back on the bill. Do we have a motion on the bill? Question being called on the bill as amended.
Mr. Chairman,
Go ahead.
I do want to say, if the bill makes it to the floor, I likely would be in support, but it's several years ago, JAC sponsored a large number of bills, many of which were the province of standing committees in the Senate, and it was communicated to us that it'd be appreciated if we stuck to our knitting, and, you know, if there's a health bill like this, nursing, that it'd be referred back to the standing committee for action. And so I think it's just a little bit out of our league. I know we could debate that. I don't intend to debate. I'm just telling you my rationale. I'll probably support it on the floor, but to me, it should be referred to the appropriate standing committee rather than as a joint appropriations committee bill.
Well,
Thank you.
Appreciate your explanation. Go ahead. Mr. Vice Chair.
Mr. Chairman, and I think the good senator's point is very well taken, and we really should try and make sure that those standing committees take action on issues that are identified in the interim. But what this committee often finds as we work through the budget, that we find anomalies within the budget that warrant correction sooner than later. And so if in this event on the public health nurses, if we waited and diverted that to a standing committee, the impacts of our actions would be delayed a full year. And so this committee has historically, as we've gone through the budget process, as we identify these unique little anomalies along the way that we need corrected, we've just taken that and added it to a burden. And so I appreciate what the good senator is saying, but I think that this fits very well into taking action now so that we can correct that problem for our public health nurses in this fiscal year rather than waiting a year.
Mr. Co-Chairman,
Please.
thank you. I know I previously have made that criticism of JAC probably around 5 to 6 years ago, that there was a lot of bills coming out of this Joint Appropriations Committee. I do distinguish this particular bill. One, its primary purpose is appropriation of monies. And so I think coming out of this committee certainly is appropriate when we look at the primary purpose of the bill, which is to provide parity with our budget bill, and its primary purpose is in fact an appropriation. So with that, Mr. Co-Chairman, I repeat the call for the question.
Okay.
Representative Swanitzer.
Representative Swanson, please.
Thank you, Mr. Chairman. I just want to clarify that the bill is actually 24 LSO-253, draft number 0.4.
Thank you for that clarification.
Well, no, a question. I assume that's what it is.
That's correct.
Okay, thank you.
Would help for the audience had we mentioned. Okay, any further discussion on the bill? Seeing none, roll call, please.
Members of the committee, the motion is on 24 LSO 0253, working draft 0.4. Representative Henderson. Aye. Representative Larson. Representative Sherwood. Representative Stith.
Aye.
Representative Walters. Representative Swanitzer Dave.
Aye.
Senator Anderson. Senator Guru.
Aye.
Senator Kinski. Senator Salazar. Co-Chairman Nethercott. Chairman Nicholas.
Aye.
Mr. Chairman, the motion is approved.
Thank you, committee. I mean, it clearly addresses something that we had a fundamental responsibility to address, to make nurses paid on an equal amount across the state. So I appreciate your reconsideration. Okay, with that, this morning is Department of Family Services. Warren, the floor is yours.
Good morning, Mr. Chairman, Madam Co-Chairman, members of the committee. My name is Corin Schmidt. I'm the Director of the Wyoming Department of Family Services. and I would like to do a few introductions if I may. Starting to my far right is Lindsay Schilling. Lindsay Schilling is the Senior Administrator for the Social Services Division. Immediately to my right is Rhonda Holt. She is our Chief Financial Officer and the newest addition to our team. She joined us about a year ago. To my left is Roxanne O'Connor, who is the Senior Administrator for the Support Services Division. And then at the far left is Christy Gordy, who is the Senior Administrator of Economic Security. Also behind me, I have Mirandy Peterson, who's one of our policy analysts, and Danielle Marks, who's our Senior Policy Analyst, in addition to Rachel Campbell, who's paying very close attention to everything you say and documenting it for us. Online, I hope to have Dell Olson, who is the Deputy Superintendent of the Wyoming Boys School, and also Chris Jones, who's the Superintendent of the Wyoming Girls School. They are in Sheridan and Worland. And then Ed is here. Ed Heimer is also behind me somewhere. Ed Heimer is our Field Operations Administrator, so he's in charge of everything that happens locally for the most part in your communities. Mr. Chairman, about preference, I know we've listening to testimonies, there's been a little bit of kind of a cadence. And so what I'm proposing is just to give a few opening remarks, move right to the exception table. And then depending on whether you want to go thoroughly through the exception table or go through the budget itself, we're flexible to do either.
So I think our preference just is to go through the budget book because we keep our notes by unit. And so it's just easier for us to catch up and also present. So
Okay.
please proceed.
Thank you. So, Mr. Chairman, we're excited to be here today. This is kind of a different approach for us as an agency. Since I was appointed, we've been facing continual budget reductions. And so today's budget comes in with some exception requests. We did not come to you with a supplemental request because we were still stabilizing after COVID. In 2020, we presented our 21-22 budget, turned around and had it reduced fairly substantially. And then since then have just been trying to get our bearing back. What we know now is what's before you in our exception requests. We haven't done a great job of funding our providers for congregate care. We haven't done a great job of really helping our own team, our own staff with positions, especially our social services aides. And then we're also doing some cool things that we wrapped into it. So I'm excited to present it to you. We think it's fair. We are hoping that it doesn't look extravagant to you. Certainly that'll be part of the debate. But I do believe that it's a good budget with a lot of thought and intentionality. Some of the successes that we experienced this year, we are for the 10th year running, #1 in our child support program. That is a big deal for a lot of reasons. We very much believe that children, families should deserve to be safe at home. And when families are getting consistent revenue, in the example of child support, that gives that family, that parent, that custodial parent, a better shot at a predictable income and then a stable household. So child support over the years has gone from a punitive type of program. We really try to look at it as a very supportive program. And in fact, that program has implemented kind of a pilot project called WIN. It's the Wyoming Integrated Network Initiative. Sorry, so many wins and Ys and ends. But anyway, what that does is it looks at an intensive case management approach to non-custodial parents who are in arrears. And with a lot of work with the Department of Workforce Services, looking to get those non-custodial parents into a place where they're better prepared to go to work. They face a lot of barriers. And so this approach then has seen some success, and you'll see that in our budget narrative. Also, another great success is the implementation of some technology and some rethinking about how we do business. That took our central registry background check from 2 weeks to about 1 day. And that was especially important during COVID when it was very tough to hire. We recognized that central registry, the check, was took way too much time. So with deliberate action and work, that has come down substantially. I do want to make a little bit of a plug for the AG's office, who's requested, I believe, 2 positions for their fingerprint checks. That is also part of what we do for people in childcare. And I think it's noted that that takes a little bit longer. If that timeline were to come down, that would help overall when hiring childcare providers, substitute care providers, staff who are doing direct care out in the field. Also important to note is our work performance rate, which belongs to our TANF families, temporary assistance to needy families. Families who are receiving cash assistance are required to work unless they meet an exemption. And in that work performance rate, we're one of the top performing states in the nation. That is in large part due to the work that we're doing in our office, but also because of the Department of Workforce Services. We provide them TANF dollars in exchange. They provide a work program for our clients. And in partnership with them, we've been able to see that rate stay very high. The irony of that rate is that it doesn't meet the performance measure that the Fed set out for us in like 1996, which is 90%. We're hovering at about a 70 to 80%. But we're working on that, trying to meet our own standard that we set that only 1 or 2 in the nation are meeting. So we're working hard toward it. We're very pleased with that rate, but we also understand that there's more work to do and we're getting there and believe we'll be there in the next year. It's also important to mention the Family First Act in our prevention plan. We submitted our prevention plan. It was approved. This is a pot of federal dollars in our child welfare space that has not previously been available to families and children who are not in state custody. So we receive federal dollars called 4E, and traditionally that's been to pay for services once children come into care. The Family First Act that was passed a few years ago allows us to implement programming and in exchange receive 50 cents on the dollar. The Family First Act and the programs that are allowed under that act are pretty tricky for Wyoming. They must be evidence-based per their standards, per the clearinghouse standards. Evidence-based practices in Wyoming can be difficult. They require a lot of fidelity. Oftentimes they require a mass. But with the way that Wyoming exists with low density, lots of space, sometimes it's hard for us to get the numbers necessary for evidence-based practices. However, we are implementing what's called motivational interviewing, and it's a practice around really engaging with clients, children, families, to understand what their basic needs are and to really dig deep to be able to put the right services into place at the right time. We're using that model a lot in our prevention space, meaning before we have to remove children and before children come into care. And as a result of that, we're seeing a substantial increase in federal dollars we're collecting in our 100 series, which then results in a savings to the state. At some point, we would like to get to a place where we're able to use dollars that we're now spending for placements and instead spend them for prevention, meaning before children come into care. And then we can double our money on those services. But you will also see an exception request for that as well. I'd also like to talk about the Marcel and Alvarez report from way back when. And we received some money a couple bienniums ago for the efficiencies. Our fiscal office has implemented 2 systems to help with those efficiencies. One, which is significant, was for our cost allocation process. I know you've talked a lot about cost allocation process in terms of the state cost allocation. But we are also required to do cost allocation with the federal government because of the type of money we receive from Health and Human Services. It's extremely complicated. It requires a system unto itself just to help us keep track of what we can be drawing down from our various federal programs, SNAP, TANF, Child Care Assistance, LEAP, and many of our other grants. ORI is another big one. So a few years ago, we came to you with a huge risk in the form of an Excel spreadsheet. That was the basis of that cost allocation program. We have now switched to a system with the help of the efficiency funds, and that is a huge relief. It was really a major point of concern. We continue to refine it as we dig further into all the nuances of that reporting, but that's been incredible. What feeds information into that cost allocation program is the time. The time that our staff spend in various activities can be billed back to federal grants. Collecting that time is incredibly challenging. And again, with the efficiency money, we were able to implement a random moment time analysis that pings people out in the field and asks them what they're doing. So they take a quick minute, they complete what they're doing, and it's through that over time and time again, it just keeps repeating itself. We're able to come up with a scientific idea of how much time any given any person is working on a particular grant and then claim that. So it's very complicated, and in a spreadsheet, of course, wasn't doing it, but what we are seeing is increased billing to our federal dollars, our federal funds, which then leads to a savings in state general fund. So with that, I know there's a lot more that I'd like to brag about, but I'll try to incorporate that as we go through the budget.
Bragging's okay. Go ahead.
Thank you. Director Schmidt, when you was appointed director, you kind of inherited a little bit of chaos structurally in your agency, and you and your staff have worked diligently to correct allocations within your budget and in funding that was concerning. Are you comfortable where we're at now? We would extend our appreciation to you and budget department for getting that rectified. But have we got all the loose ends or all the alligators back in the pond that we need to?
Mr. Chairman, Representative Larson, I think there's a few little alligators out there, but we're rustling them up. For the large part, we believe that the budget is at a solid place, and there's always little tweaks, and you'll see some of those tweaks on an ongoing basis, especially in this exception request, where we just encounter things that need to be fixed. And there was, and Kevin can argue with me, but there was at one time kind of a sense in state government that the authority, the federal authority, was just out there and really didn't pay much attention to it. I believe the federal authority is very important because it really depicts what we're spending. And so over the last few years, we've been working hard to align our federal authority with the actual grants, which do change from time to time. So I would expect that we'll come back with some tweaks fairly regularly just to fix through an exception request the authority that's allocated to us from you to match our federal grants. In our budget today, you see some significant fixes in that manner. But for the most part, the work that this team has done has been incredible. We did a mock JAC hearing a couple of weeks ago in preparation. I won't tell you who's who, but but what it does is it brings everybody's eyes onto the document so that we universally understand what it is. It also helps us to pick up things that maybe we didn't see. When your eyes are around these numbers all the time, it's easy to miss something. And so from that, what it told me is that everyone here, everyone on our leadership team completely understands their budget. And with that, we'll continue to make tweaks. So thank you for that
Again
opportunity.
next year, Kevin would probably sit in on it as chair.
Mr. Chairman, I have enjoyed those opportunities.
So with that, I think we can go ahead and move into our exception
Let's do it.
request, if that's okay, Mr. Chairman. So on page 16 of your budget, you see the exception request table, just a few notes on that. The numbering did get a little bit messy on our priorities. We had a last minute request come in for a rate study, which did mess with that a little bit, but the order is the order that we want it to be in.
Is it the same as this?
Yes, and also provided to you was a little bit of a cheat sheet. That's mainly for your purposes, just so that as you either walk through this process, I know that sometimes when you're on the floor, having a little bit of a summary is helpful in some of the high points of the request. Looking at the exception request table, what you'll see is basically numbers 1 through 12 are some of the newer requests and adjustments to the standard budget. Everything from 13 on are those budget fixes. They're fixing authority, they're realigning positions with the right budget unit. So the first 12 are really those places that certainly will probably have a lot more discussion. The rest are the cleanup, as Representative Larson mentioned. So if you would like, we could go to the boys' school, the Wyoming Boys' School, starting on, and that's budget unit 5801, which starts on page 25 of your budget.
Please.
So the Wyoming Boys' School, which is located in Worland, is a combination of somewhat of a correctional facility and a reform school. So boys that have been adjudicated delinquent under the Title 14 statutes are placed there, court ordered there by a judge at the recommendation of the community. And it's there then that they spend whatever time as appropriate based on how they are doing. It's not a sentence per se like to a prison, but rather it's placement at the boys' school. And the boys walk through their treatment, go through their treatment, which includes a lot of schooling. It's heavily educational. It includes some mental health services that are provided by the Community Mental Health Center. And then just a lot of work directly with our dorm staff and other teachers, basically just to work through whatever issues that brought them to the attention of the system and eventually got them placed. They average about 45 students at any given time. And they have, we've had a couple of shifts in leadership there over the last 4 years, 5 years. The boys' school is stabilizing. We're starting to see a lot more interventions with communities, a lot more opportunity for the boys to go out, which is good for the boys, but also good for the community. They've been doing a lot of volunteer work and just some exposure to the community at large, because at the end of the day, when they go home, we want them to be successful.
Go ahead.
So the first request is on,
1 second.
oh, I'm sorry.
Whoa.
Representative Larson.
So Director Schmidt, just as we have conversations in this committee on the boys' school and the girls' school, and this be a good time to do it, the funding on that, we don't see a lot of federal funds, and that's because of the court placement. We're not able to capture like Medicaid and those sorts of things as we look for efficiencies. So just correct us on that. I think most of it's general fund, you get an education component, but most of those are just general fund dollars to take care of the kids that are there. Is that accurate?
Mr. Chairman, Representative Larson, yes, this is 100%, for the most part, general funded with a few dollars that come from the Department of Education for an at-risk youth, for children in care or delinquents. So we do get a little bit of the Title I money, and you'll see that as kind of a cleanup in the budget. We are working hard with the Department of Health to think about the services we provide at the boys' school to understand if really they're correctional in nature for Medicaid statute, or if there are some ways that perhaps we could resubmit a definition to CMS, big Medicaid, to receive some federal dollars for the services that are provided there. It's kind of a shot in the dark, but we're hoping.
Follow up, Mr. Chairman, and then also as we've had the conversation over the past few years about kids with high behavioral needs that aren't adjudicated, there's always the question, well, can we not send them to the boys' school or the girls' school? And if you had just explained that, I believe that that's not allowed, that that's an inappropriate placement for those kids because it's correctional facilities. But if you would just help us briefly understand that.
Yes, Mr. Chairman, Representative Larson. So at any given time, we have about 15 to 20 kids that have very complex needs. And there's temptation oftentimes to send them to the boys' school or the girls' school because we know they can be safe. However, in order to go to the boys' school or the girls' school, you have to be determined to be a delinquent, which means you've committed a crime. Many of the kids that we see, these 15 to 20, have behavioral health issues. They have mental health issues. But oftentimes, if there has been a crime committed, it's been a result of their behaviors. It's not an appropriate place to put kids because there isn't the therapeutic intervention that they need in order to really be successful. It can be a temporary setting if it's safe, but we try very hard then to work to get those kids back into a more appropriate setting, which usually is at the level of a psychiatric residential treatment facility or a residential treatment center that takes high needs kids. The Medicaid dollars that go to the services provided by the boys' school through outpatient services are 100% general fund. So the Medicaid program with their general fund will pay for those services, but they're not eligible for any federal reimbursement. That's the thing that we would maybe like to change. Those conversations are very new. And as you all, I'm sure know, especially after the presentation with Director Johansson yesterday, Medicaid is pretty tough to move, but it's certainly worth a conversation, especially as these kids age out of care, which means that they become adults under the supervision of the department, which really does set up many of those kids for a pretty tough life. So that, Mr. Chairman, is kind of the interface of Medicaid with both facilities.
Senator Drew.
Thank you, Mr. Chairman. Morning, Corin. Question. Narrative says 13% of the kids at boys' school are readmissions. Is that about normal? Is that an average, higher, lower? What do you see there?
Mr. Chairman, Senator Guru, that's fairly consistent, but it is going up a little bit. And the reason why it's going up is because we're seeing younger kids placed there. So if you have a 12-year-old, a 13-year-old placed, chances are we may see them again. And so that's, again, part of the community-based services. A lot of the conversation we're having is what are we doing to help those kids be successful when they go home? Because they go home to a family, and it's oftentimes the family that needs a lot more support, not just the child.
Mr. Chairman, thank you. Director Schmidt, I have a question if you know about the population distribution in the boys' school. It used to be somewhat uneven with, for example, my county accounting for 25% of the residents at the boys' school, which was just an anomaly. If you know, has that evened out a little bit? Is the sort of administration of justice a little more uniform now than it was in the past, if you know?
Mr. Chairman, Representative Stith, in 2023, state fiscal year 2023, we saw the majority coming from Natrona County, Sweetwater County, Campbell County, which would be appropriate based on the population distribution. Laramie County is 6th down the list. So yes, we have seen somewhat of a redistribution. Sweetwater County isn't the primary outlier as it was for a long time, but Natrona County places the most kids.
Madam Co-Chair. Okay. So going to the appropriation itself.
Yes.
You're asking for night staff. What's been the positions in the past? Were those positions cut before, or have they already had them? give us a little background on those positions, requests.
Mr. Chairman, the positions that we're requesting are overnight dorm staff. They're at an SOYS 03 level, which is entry level overnight. In 2020, part of the budget reductions, we did reduce a number of positions at the boys' school, which included a dorm closure. What we did in that reduction then was kind of remove any of the flex that we have to be able to fill in when there are people out sick or when there's an incident that requires a few more people to pay attention to it. And the way that the boys' school is organized, it's in dorms. So it's 3 distinct buildings, which makes cross coverage very difficult. What we have found after the reduction is that our overnight dorm staff have struggled with being able to provide continuous supervision while addressing high needs of other youth. So our population at the boys' school has stabilized, but what we do see are more youth with more needs that require more one-on-one care. So as in the past, when we were seeing more of a straight delinquent population, the supervision was a little bit more straightforward. Now, a lot of times it takes 1 or 2 people to work with a student, which then moves people off of their dorms, which we really do not want. That then leaves one person maybe there with all the kids. So this is to supplement that overnight workforce.
So 2 different questions. One is this the equivalent of what you had in the past for staffing, or is it more, or is it less in terms of your night? And then the next question, well, that question first.
Mr. Chairman, this is real similar to what we had in the past.
And then you mentioned that you also have some staffing issues just in terms of filling positions. Do you currently have that problem now? And if so, I mean, what are you missing and what do you need?
Mr. Chairman, yes, we still are having some turnover issues. One of the reasons is because in the next step up at a 6, or even going to a security officer or going to a daytime person pulls from that overnight staff population. So people will come into the facility, take one of those overnight staff positions, and then immediately move up when there's another position available. So that kind of churns then that very entry-level position. We do continue to look at that. The girls' school has stabilized, and we're not seeing the number of churn. The boys' school is still kind of going through that process. We believe that the compensation increases of July 1st have made a really big difference in our agency. We've traditionally paid very low wages on the scale. So the compensation package has been great. Also, the concept of 90%, 93% is very helpful. So we are working on that. The boys' school is also, and I guess let me step back a little bit. From an agency-wide perspective, we recognize that turnover continues to be a problem. It has come down a lot, but it is still there, and turnover hurts the work that we do because we rely so much on our direct care staff to be able to build relationships with kids, with families. So when that gets disrupted, it's very hard on the child and on the family and basically on the process of the case. So we have spent the last 6 months overhauling our onboarding process to be able to shorten a lot of the timelines between when a position becomes vacant, when it gets posted, when it gets filled, so that we're doing a better job of hiring. We know, and just from basic HR, that a person's experience with us from day one, from the minute that they put in an application, matters. We are selling ourselves from that very point. And I think overall, state government has had a tradition of, post a position, let it sit open for a while. You may not hear from us, you may hear from us. And then we may hire the position and then you get kind of a cold email. We're really wanting to change that experience. So looking at the overhaul of our onboarding has been a big focus. We're working with ANI now to test some of the forms so that as people come on, they're consistent, they know what their benefits are, they know where they're starting, they know who their supervisor is, they know they have a computer that works. All those things that are so important to get in place from that very first day experience. So overall, we're doing a lot as an agency specific to the boys' school. We've seen some people who left that have come back. So we know that in Worland specifically, it's really going to be reputation. I do believe that the superintendent is working hard on that. The philosophy of the boys' school, while it aims to certainly understand that these are delinquents, but that also relationship building with these kids is what's most important. They've been through some trauma responsive care, which means that understanding some of the trauma that these boys have gone through, and some of it knowing some of the stories, very specifically, huge trauma. And of course, when you're 16 years old and you're big and you're mad, it's going to show up in behaviors. So working with our staff to understand some of that logic and then engaging with the boys in a little bit of a different way is a little bit of a cultural shift. So it's a slow cultural shift, but I think it's building a stronger organization. And as we know, some people have returned because of it.
Any further questions?
Mr. Chairman,
Go ahead. Please.
Mr. Chairman, I understood you to say that they were asking for 9 positions, but I think they're asking for 3 positions that would bring them to 9 positions for the overnight 3 dormitories. Is that correct, or have I got that wrong?
Mr. Chairman, Senator Anderson, yes, this would bring us up to 9. It's for 3 positions, 1 for each dorm.
Okay, please proceed.
So if there are no more questions about the exception request for the positions, Mr. Chairman, we'll move on to page 27. And we have priority number 17, increased Title I spending authority. This is a reflection of the amount of money we do get from the Department of Education. This is primarily spent on career and technical education type educational services. The Title I money is specifically for adjudicated, meaning in the placement of the Department of Family Services. So these are specific dollars for those kids. This is just an authority fix.
Representative Larson.
And just want to verify that 100% 5005 is funds from the Department of Education reimbursement.
Mr. Chairman, Representative Larson, yes, that's from the Department of Education.
So, Warren, how much money does the school get in its entirety from the Department of Education?
Mr. Chairman, out of the Title I money, we get about $36,000. That fluctuates based on census. So this is never going to be consistent, and then it's split between the boys' school and the girls' school. So the Department of Education receives its Title I allocation. They distribute it based on census, so it will change. We also get some minimal funding for special education services. That has, at the boys' school, it goes to a contractor to provide aid services, but those dollars are minimal.
What's the average stay?
The average stay, I think, is about, Mr. Chairman, is about 7 months.
So the question is, during those 7 months, do they get any supplemental educational assistance?
Mr. Chairman, no, the educators at the boys' school and the girls' school are 100% general fund. We don't get any of the ADM money. Those dollars are kept by the Department of Education. So it gets a little bit trickier, but when a student leaves the district, if for longer than 10 days, then those ADM dollars are no longer counted, but we do not receive any of those dollars.
Do you provide educational services to them?
Mr. Chairman, yes, we provide the full array of educational services.
I'm just curious why there's not a transfer of funds.
Mr. Chairman, I think that's possible. What I would say from an administrative standpoint is that having the consistent funding to be able to provide the educational services, no matter the census, is important. And so if we start to look at an ADM type approach, we're going to have inconsistent revenue coming in because our census is going to fluctuate. So we have operational costs, whether we're serving 5 kids, whether we're serving 45 kids, we still need to meet those needs. I think it's a policy call as to how those state general funds end up in our budget. So if that means a shift, I think that's your call, not our call. But certainly what I would ask is some stability and consistency in the funds and not based on a per diem or a daily rate like the educational system
Some
did.
sort of formulaic process.
Yeah.
Go ahead.
But as you illustrated previously with your federal funds, trying to capture as many of those as you can, it seems like a possible approach, a similar approach could maybe be used on capturing Department of Education funds for those kids when they're, whether it comes proportionately that you ought to be able to then come back to the Department of Education and say, we had this student here for this number of days, provided these services. It doesn't take away from your ongoing operations, but we're just getting reimbursement from those back
Yeah.
from the education side. Is that a possibility?
Mr. Chairman, Representative Larson, yes, if it's based on a reimbursement type, if it doesn't affect our consisting funding, then I think that's certainly something that you could all entertain. It's bookkeeping, really.
So, Corin, I think we would, if, my suggestion is that you come up with a proposal you can bring back to us during our supplemental budget. Just so that we can flesh this out, because obviously you're providing the services that the Department of Education should be paying for. And so we ought to have a mechanism to put the right dollars in the right place.
Mr. Chairman, we can do that. We'll look at the average daily stay. We'll look at the educational services received. We can do kind of a prorate of the salary dollars based on that and come back with a figure. Sure.
Thank you. Madam Co-Chair.
Mr. Co-Chair, I think that's a great solution and something that I think we should drive towards. I'm just wondering if you really want it in the supplemental budget or something sooner. Yeah.
Well, I mean, in callbacks. I'm sorry. You're right. Something sooner would be in January.
Mr. Chairman, Co-Chairman Nethercott, yes, we can have something. It will be probably pretty preliminary, but we can certainly have a working number for you.
Thank you. Okay, please proceed.
Okay, moving on to page 28. Again, this is a budget adjustment, moving a position that actually works out in the field, out of the boys' school budget and into the field budget, which is 5915.
Okay, proceed.
And then priority number 21, still on page 28, is just to correct the funding for the 2 positions. This is a legacy issue. At one point, the boys' school and the girls' school did receive independent living funds, which are federal. The Fed said that that's not allowable at the boys' school or the girls' school. We're just now fixing then the authority that was assigned to those 2 positions so that they're state general fund.
Okay.
Okay, moving on then to the girls' school, which is starts on page 33. This is unit 5802. We have 3 exception requests in here as well. Moving right to page 34, we had requested another overnight dorm staff person for the girls' school. The governor denied the request, which we are fine with. When we submitted our budget exception requests at the beginning of the summer, over the course of the next few months, what we realized is that we can reclassify a position if it becomes necessary. Our census has stabilized, and so they're sufficiently covered for now.
Okay.
Continuing on is a little bit more budget cleanup, similar to what you saw in the boys' school. So looking at page 36, increasing the Title I spending authority. This goes back to the Title I dollars received from the Department of Education. It's just giving permission in the budget to spend it. On page 37, we have priority number 22, again, a correction. For the one position, this is independent living funds that are no longer allowed to be spent at the boys' school. So moving on to the next division budget, which is 5,900. This is the majority of where we spend our time. And I just realized I forgot Liap. But we have no exception requests in there, so we're fine, which is why I forgot it. Sorry. Looking at Unit 5901, this is our administrative budget. We have 3 budget exception requests in this. This is where we kind of capture all of our operational funds. This is a lot of the staff that we have in Cheyenne or across the state, our program policy folks. Our fiscal team is in this budget. We have our fraud and detection unit, fraud and integrity unit in this budget, along with the director's office and a lot of our support services. Just a moment on our financial services, and I think this is probably goes without saying, but I do want to say it. Our fiscal staff over the course of the last 3 years with the inundation of COVID, CARES money, ARPA money has done tremendous work. We recognized early on that these were one-time dollars. We really didn't want to have to staff up temporarily, staff down temporarily. So they took on the lion's share of the reporting work, of the transactional work, which was significant. Those dollars doubled our budget. So while we brought some part-time staff in, some temporary staff, really the amount of work around the federal grant management, which is substantial, was with our fiscal office. And I'm sure they weren't quiet about it amongst themselves, but certainly they took one for the team publicly. And so I just really want to express my appreciation to them, and thanks to Rhonda. So moving on, in this particular budget, we'll go to page 45, which is the ETS replacement request. And we have data and numbers on what this means. If you have any specific questions, we also have it available on a cheat sheet if you want it. I do want to point out some anomalies in this particular request and in all of our technology replacement requests. Because of how we're organized in the data that we collect, primarily federal tax information, we do purchase computers for a lot of our partners. There's state purchase computers that go onto the state network. And in order to provide the security and protections to that information, we do extend that to the county clerks. We extend that to our child support offices. We extend it to our tribal offices. So if you do math, you're going to realize we're asking for a lot more computers than we have staff. And that is the reason why.
So I note that you have a 5-year replacement order versus a 4-year. Is that just standard practice, or that's a number you choose? Should the whole state go to 5 years?
Mr. Chairman, I will let Roxanne O'Connor answer the questions about all those things, technology replacement.
Thank you, Mr. Chairman. From our understanding with working with ETS, the warranty for all state purchase computers is for 3 years. ETS then covers the 4th year of warranty. So then what you see in our replacement is when those computers hit their 5th year of life, that's when we start to replace them.
Mr. Chairman, thank you. You heard yesterday and the day before, perhaps, Director Sheehan say that the cycle is a 4-year cycle replaced in the 5th year. So pick how you think about 5 versus 4 there, but it's replaced in the 5th year. That might be the very first day of the biennium. That might be the last day of the biennium, but when that happens, it's in the 5th year.
Okay,
Mr. Chairman.
go ahead. Representative Swanson.
Thank you, Mr. Chairman. Roxanne, do you have the number of the total number of computers, possibly monitors, scanners under the purview of your agency? Or can you find that out?
Mr. Chairman, Representative Zwanitzer, yes, we can get that number for you. What I can tell you is that what you see here in this exception request is the vast majority of what we have under our purview.
So Kevin, that's actually a good point. Because we're always curious, where are we in that cycle? Were you on, and how many are replaced on a regular basis? And so if in the budget books, they would say we're replacing 1/4 in this biennium, or it's 2, we're replacing 1/2, and this is the total number. That would simplify all the questions we need to ask.
Mr. Chairman, I believe what I understand is that you would like us to include computer counts in the TRP exception requests. I think we've done that in the past, and it's very busy work, but we'll still provide you with the ETS inventory. I think that's really what we're looking for, is the ETS inventory. And the process is the same for everybody. We meet in the spring with the agency, with the state budget department. ETS does the work, and it's applied uniformly across the enterprise. Despite sometimes you might hear things presented like, well, we do a 5-year replacement. Well, it's really the 4-year replacement cycle replaced in the 5th year.
Mr. Co-Chair.
Go ahead.
Yeah, I think this has been the theme all along, and where we've been driving at in this conversation is to do this more intentionally and more thoughtfully, recognizing that these are really ongoing costs. ETS has a policy. All of our state agencies are trying to fulfill that. And so we need to get on a standard practice of every agency is replacing either all or 1/4 or 1/2 of all of their computers and associated equipment every budget cycle, right? And so everybody is getting that full replacement, whatever that looks like, in order to achieve that, instead of these one-time exception requests that come in varying degrees. I think that that's a reasonable outcome when we get on that schedule. But Mr. Hibbert appears like maybe that's not so easily done.
Mr. Chairman, this is driven by the fact that the 240 series, anything in the 240 series is a one-time request. And it is the expectation of the legislature that we come in with these exceptions one time. There is a standardized process. It just, at times, I'll give you an example. We want to have a conversation with you about compensation to where the governor's office can lead the conversation. We want to have a conversation with you about inflation so that we can lead that conversation. This is an example where we have exception requests in the agency's budget so that we can establish the collection of the proper funding source, whether it's general funds, federal funds, or other funds. But it would be more convenient for us all if we had an enterprise conversation on this to alleviate those questions or that concern that there isn't a standardized process. It would be nice, and we will have a budget refresher course on this as well, as we do every year, to show you that process. It would be okay to do anything that you'd like to have us do to reflect that, in fact, we do have a standardized process. And things aren't 100% 51% biennium or 50% the other biennium. There was some things that took place with COVID dollars that allowed us to facilitate some of this. So you're probably not seeing those requests when they normally would. We just got them bought on the same cycle. We didn't violate the cycle, but there's just other influencing factors. But we'll do anything that we can to help you understand this better.
So, Mr. Hibbert, and kind of for the committee members that may be a little bit newer, this conversation really comes back to our days in the Jonah building when we found that the replacement, when ETS was first created, we found the replacement policy was all over the board, and maintenance agreements were all over the board. And so we've tried to define that approach. And I think, Kevin, we understand and we've approved the, based on that expertise of at the end of 4 years, you replace it in the 5 years. We're just asking for a little more understanding. When you see 847 computers, does that represent what percent does that represent? We're just asking for a little more detail to, when we read that we don't have to ask these questions, and we appreciate that it's being done, but you know, that's all we're asking for. And I appreciate that it's busy work, but it's important work for us.
Mr. Chairman, we'll be pleased to do anything that we can to facilitate this. And I just want to have one last comment. I do appreciate Director Smith's comment when she opened up on page 45. Her quote was anomalies. This is an example where you can't do a body count to computer count because an agency is purchasing computers, in this case for security reasons for local governments. But I really do appreciate that conversation. But what we can do is we can put in there ETS. You see down there the thing, we have an ETS approval number. And with that ETS approval number, what we can do is we can say what this is the number of computers, and I think talk about state employee machines versus other situations where we have the need to purchase computers for the local governments. We're not resistant to that, and I believe that there's we'll explore how this would happen, and I actually think that there's an opportunity with the package that we asked for inside the state budget department request. There's a feature that we're looking at can actually do this for us. So we'll see if we can leverage that.
Mr. Chairman?
Please, go ahead.
Thank you, Mr. Chairman. I'm not trying to beat a dead horse, but help me understand who takes the lead on if they need computers. Is it the agency that takes the lead, or is it ETS that comes to the agency and says, look, I've gone through the inventory and what I see here is what I perceive that you need. And if I could understand that, life would be much easier.
Mr. Chairman, ETS is the agency responsible for the policy on the replacement cycle of computers, black and white. We have conversations with every single agency in the spring, and we go through that inventory computer by computer. We establish the life cycle, and we then establish the number of computer replacements that are necessary to fit in that policy. So ETS drives it, SBD shepherds it, and the agencies are clearly involved from the beginning, cradle to the grave.
Please go ahead.
Mr. Co-Chair, thank you. I want to make it clear. I want to make it clear that my concern is not about the number of computers. I actually trust all of our department heads to make appropriate decisions regarding the number of computers that they need, whether it's for their employees or for their vendors or whomever it might be. It's not that decision or even internally how you're deciding that. What's clear to me is that after decades of working with computers and in a digital age and in today's world of cybersecurity and the request of ETS to create a uniform policy, we now have that. And it's now being implemented. So I think there might be an easier way from a budget perspective, both for the agency heads, the state budget department, and the legislature to timely account for these costs, recognizing that we will be replacing all of the computers that belong to the state, regardless of how many there are, every 5th year. And so that's a fairly predictable cost, recognizing that that does change over time, but fairly predictable and should be part of an ongoing budget request, as opposed to one-time budget exceptions that really aren't one time, right? They should be ongoing. This is our policy. We have all adopted that. We have agreed to move in that direction. So really what I am proposing is there a smarter way for all of us to do this together, recognizing that this is the path that we're on, recognizing that this is a somewhat predictive fixed cost that we can appropriately budget for, both now and in upcoming bienniums, and much easier on the agency heads as well. So that's it. That's my comment. We don't need a solution right now. But I do think that there's a smarter way, more efficient way to understand these requests.
So Madam Co-Chair, what I would suggest we do is probably take that up as part of an interim topic for joint appropriations, because that's really our call on what we ask for, because we're the ones that have determined that it's a one-time expense, so we want to review all those one-time expenses. But definitely, if it makes sense to do it, then we should evaluate it and make that type of adjustment to the budgets.
I mean, we can make that decision for an interim topic. I don't know that it's that complicated that we need an interim topic, but certainly worthy of evidently further exploration.
Mr. Chairman, we're certainly open to that. The one caveat being is that we want to maintain the association with the funding source, whether it's being purchased with a federal dollar, a special revenue dollar, or a general fund dollar. We don't want to leap this thing to where we're not accessing those other funding sources. That would be my caveat.
I have full confidence, Mr. Co-Chairman, Director Hibbard, that we have that capability despite making this process more efficient in light of our new policy of replacing all state computers within that 5th year. I believe that we can still do that.
Okay.
Mr. Chairman,
Representative Stitt.
one final thing. Director Schmidt, I noticed in the narrative on this request that it said that the number of 847 computers was generated using a report from ETS of the manufacturer warranty expiration dates. So can you help me with, is the warranty expiration, I mean, do they have a 5-year warranty? Do they have a 3-year warranty? Right. And so if it's a 3-year warranty, then it seems like there is a mismatch here, right?
Go ahead.
Mr. Chairman, we would apply the policy of the 3-year warranty, 4th year under ETS, 5th year replacement with that report. So we get the warranty date, we apply the policy, and then that's how we figure out the number of computers. So all of the computers that we're requesting will end of life or will be in their 5th year of life during the 25-26 biennium.
Mr. Chairman, the warranty date is control. It's the 3 years that the providers give us. We extend that past the warranty date for the 4th year and replace it in the 5th year. That's by intent, but it's just a control feature. It's a statistic that we use to identify the replacement cycles for computers. It doesn't suggest that we're doing it in the 3rd year.
Okay, please proceed.
Hey, Mr. Chairman, moving on from the replacement program technology onto page 46, priority number 10, add general fund to increase the emergency solutions grant, which serves homeless people and those at risk of homelessness. This is a federal grant that has a required match. The required match is provided by the local nonprofit organization that receives the grant. This is a small effort of general fund to be able to continue to support and grow this program just a little bit. This was recommended in an assessment that was done under the Meade administration, finished under the Gordon administration, that said to maximize this particular grant by everybody having skin in the game. So locals, feds in the state. Right now, there are no state general funds that go to this program. This is a request for an equal match of state general funds.
So this is the 696?
Yes, Mr. Chairman.
Okay. Representative Larson. Okay, any other questions? Seeing none, please proceed. Nope, it's too late.
Okay.
No, go ahead.
I just was curious how many communities or how many counties around the state have been awarded grants through this? Is it localized, or do we see it being used statewide?
Mr. Chairman, I have that. Currently, we have community providers that serve Campbell and statewide, Crook County, Weston County, Natrona, Sheridan, Sweetwater, Natrona, and then Laramie County. So it's not a lot of money to go statewide, but some of the organizations do spread it out a little bit more.
And so it looks like this will go into your regular budget.
Yes, Mr. Chairman.
All right, please proceed.
Moving on to page 47, priority number 15. This is a little bit of a budget correction in terms of authority. Currently, and I think I'm going to let Rhonda explain this one, or do you want me to tackle it? This is just the adjustment in authority because of how we move money around. It's not in the right place. So instead of doing a B11, we just want to add it into our budget so that we have the flexibility when the time comes. Mr. Chairman, I can't beat that. Yes, yes, they're asking for.
Okay, please proceed.
And moving on to
Go ahead.
budget unit
Representative Larson.
5903.
We maybe just ask, so we see the title of 6703 is DPAS overpayment. And maybe we could just, in an interim, take a glance at some of these and make sure we correct the names and where they're applicable.
Yes, Mr. Chairman, Representative Larson, we've been doing some checking on the revenue codes and the names given to the revenue codes. And as you can see, they're a little archaic. DPAS was the 90s. So we will be working over the next biennium to get the revenue code names a little bit more current.
It's kind of sentimental to some.
Yes, Mr. Chairman,
Go ahead.
I do remember the days of DPAS. Okay, moving on to budget unit 5903. This starts on page 51. There is an exception request for this that starts on page 52. And this is a rate increase for crisis stabilization services. So this, you will see this particular request repeated again in 5915. And this is a request for our congregate care providers that provide overnight services, 24-hour, 7-day-a-week services to many of our youth who need a higher level of care. It's a little embarrassing, but really the last time that we gave any type of substantial increase was 2012. The providers, thanks to this committee in 2022, gave a little bit of a bump of 3%. But what we know is that the department is responsible for room and board, and we've really not increased that rate for a decade.
So Corin, could you tell us, the request is for 3.7, the Gov's recommendation is 2.7. What would those two numbers move that 117 per day to?
Mr. Chairman, we did a rate study, so each of the rates now are dependent on the individual provider. And just to give you a little more context, I'm going to let Lindsay Schilling explain the rate study, how we did it, why we did it, and you'll see it applied to this particular level of service, which is crisis stabilization. And again, you'll see it for group homes, you'll see it for residential treatment centers, and for Board of Cooperative Educational Services that are residential BOCES. This does not include the Psychiatric Residential Treatment Facility, the PRTF. That's a Medicaid payment. That's a Medicaid service. So we do not contribute to that. And it does not include educational costs. The rate study is only for room and board, which is under the court order placement statutes, is what the Department of Family Services is responsible for.
Go ahead.
So, Mr. Chairman, before Mrs. Schilling talks to us about that, because I don't think it's just take and pluck numbers. I think that there's some methodology there that you've put into place with the different options. But Madam Chairman, to your point, I think the failure to rebase this since that time was because of a budget reduction we took in 2015, 2016, which we required you, we sacrificed that rebasing dollars and it was never replaced. And so although Department of Health, Department of Education had continued on with their practice of rebasing for those same, for their services for those providers, your agency was left ride and drag and just hadn't been hadn't done, and we haven't made any adjustments in that period of time. Is that how we got to this point?
Yes, Mr. Chairman, Representative Larson, yes. In 2016, the amount of money that was allocated to do this regular rate study was cut from the Department of Family Services budget. The premise back then is that we were facing deficits in the budget. So what was the point of studying the rates if there were going to be no subsequent rate increases? So last year, through the supplemental request, we received a little bit of additional dollars. And with the work with our providers, decided to use a small portion of those dollars to do the rate study in time for the exception requests that we're presenting today. And Ms. Schilling will explain some of the methodology because it is a bit of a shift in how we're approaching these costs.
Go ahead, Michelle.
Mr. Chairman.
Senator Anderson, go ahead.
Mr. Chairman, I noticed that the governor cut this budget down to $2,790,000. Is that enough, or how many dollars per day does that mean that you'll reimburse for? It's probably not the 117, huh?
Mr. Chairman, Senator Anderson, it's what the governor recommended is 75% of the request. And so as we look at this particular number, we'll have to make adjustments to the rate analysis to account for the 75%. The request we made was based on 100% of what the rate study had recommended. So we will have to do a little bit of math to accommodate this reduction.
We like math. Go ahead.
Good morning, Chairman, members of the committee. For and introduce me, Lindsay Schilling. She covered the first part of it. Sure. Is that better? Okay. So again, as the director mentioned, until 2016, we were, DFS was contracted with Navigant, as was Department of Health and Department of Education to establish rates. This is a cohort of youth services providers that are reimbursed by all three agencies. So there's a collaborative effort between the three agencies to establish rates to prevent duplication across the board. So until 2016, we participated, then dropped out. Fortunately for us, Department of Education and Medicaid continued to partner with Navigant, now Guidehouse. They changed names somewhere in between. So it was actually really advantageous that we were able to jump back into that triple agency effort and re-engage with Guidehouse as they had continued to do the work. So the contract between DFS and Guidehouse was executed in May, and we kicked off the provider cost report effort in June of 2023. So just this last spring. Provider participation was completely voluntary, but I'll tell you, we had over 90% of our youth services providers that engaged with us, confirmed cost information submitted, and worked with us through the study. Rates were calculated and modeled 4 different methodologies. We worked really hard to align our methodology with what the Department of Health already does to establish PRTF rates and what the Department of Education already does to establish the education rates. To account for variation in discrepancies reported in administrative costs and occupancy rates, there are a series of adjustments that can be made to the rates to be sure that everybody's brought to a statewide average so that we're not creating facility-specific rates that favor high admin costs or low occupancy rates. And then once again, engaging with the same contractor that worked with the other 2 agencies, we were also able to confirm no duplication of allowable costs across the 3 agencies. So we're confident in the methodology and confident in the outcomes. For purposes of the DFS rate for room and board, allowable costs included anything related to room and board, non-licensed observation and supervision. So examples include direct care employee salaries, program support supplies, rentals, mortgages, maintenance, and repair costs of the facilities. Non-allowable costs included anything required to support education services. Those were captured in the Department of Education effort. Clinical service costs that would be eligible for Medicaid reimbursement, and costs associated with operations of any other business not necessary to provide client care such as advertising, bad debt, entertainment, lobbying, and fundraising. The rate model does not make any revenue adjustments for fundraising, so we left all of that revenue in there, but did remove revenue associated with the National School Lunch Program. And again, this was another opportunity to ensure there were no duplication of reimbursements to providers. At the conclusion of the cost study and the analysis, what the data shows is that our current room and board rate is meeting only approximately 50% of the total cost providers are absorbing to provide services to our DFS youth. Moving forward with the implementation of what we've recommended includes the adjustments for administrative and occupancy percentages, and would actually implement facility-specific rates for each of the 4 different peer groups. So it's a bit of a shift in ideology and reimbursement from DFS, where we historically reimbursed a set fee for the service type. Now we're looking at actual costs incurred by provider, which accounts for regional variation, staffing costs, et cetera. We also plan to continue ways to re-engage with Department of Education and Department of Health more routinely to keep the rate study updated, whether that's every 2 years or every 3 years. We'll continue to have those conversations. So what the exception request reflects is 100% of the cost to implement the adjusted rates, facility-specific rates for each of the group homes, residential treatment centers, the Board of Cooperative Education Services providers, and our crisis centers.
Okay, do we have the numbers?
Chairman, did you want me to discuss facility-specific rates, or would you
Just
like
general.
just averages?
Yeah. Just compared to the 117.
Mr. Chairman?
Go ahead.
Ms. Schilling, however, if I think for us, we would like to think that, okay, we was at 117 or so with this study, we're going to now be at 120. But I think as I read that study, based on what the allowable costs are, you could see that fluctuate. Maybe you could maybe see some having a decrease in the daily rate, and you could see others increasing. And so I think it's an overall adjustment rather than a provider by provider guaranteed specific increase. Is that, so it's hard to just say what it's going to be across the board on a day rate. Is that a fair conclusion?
Mr. Chairman, Representative Larson, that's correct. Anytime you go to facility-specific rates, there are opportunities for winners and losers. Internally and with the Wyoming Youth Services Association, we've sort of started conversation on what a hold harmless provision might look like. We could phase in reductions, we could hold them harmless and not do reductions.
And then, Mr. Chairman, follow up, and then am I understanding that now that we have that and you've selected the options that you think are viable to go forth, you take the proposed and maybe, I mean, we're here at the proposed rates, we've got the governor's recommended, but you are engaged with the providers now to have those conversations on how that might be implemented.
Mr. Chairman, Representative Larson, yeah, I met with Bruce yesterday. So to answer the question on the crisis center rates, the current rate is 117 a day. The calculated rate moving forward on average, statewide average, would be $188 a day. If we look at peer groups for residential treatment centers, right now we reimburse $180 a day. The calculated rates range from $227 to $365 a day. The Board of Cooperative Education Services, sort of noting that they provide a lot of intensive special education services for a lot of our incredibly challenging youth. They're currently receiving $180 a day. Those rates would go up to between $422 and $568 a day. And then on the group home side, our current rate through contract is averaging $141 a day. Those rates would increase in range. Some of them did decrease from $111 a day to $330 a day.
And so the $188 a day on the crisis center on average would be reduced based upon the governor's reduction, right? So that'd go down to 165 or whatever the number is.
Right, Chairman. So if the reception requests were funded at some percentage of the total request, we would simply calculate all the rates at that same percent.
Okay. That helps. Thanks.
And on each of these, they were reduced 25%. The governor's rec is a reduction of the proposed by 25%. So that's consistent. Is that accurate?
Mr. Chairman, Representative Larson, correct. The rates I just read are assuming full funding of the exception request. Those would all be adjusted.
And then if I may also just make sure I understood it correct, the guidepost study really brings forth a different approach based on the type of services the provider provides. Whereas previously it was just, they were kind of lumped into one. So this more accurately reflects, like the BOCES, the largest, who will see the largest increases because of the types of services that they provide compared to perhaps a group home or QRTP, right?
Mr. Chairman, Representative Larson, that's exactly correct. We moved forward with creating peer groups to be sure we could adequately represent and appropriately represent the costs incurred by each facility.
Go ahead.
Thank you, Mr. Chairman. Good morning. Just a quick question. I know we're doing today just room and board, but you said something earlier about education and how that program, how that component gets funded. That the Department of Education funds the group homes based on a formula. Did I hear that right?
Chairman Senator Grew, that's correct. It's under the court-ordered placement statute. The Department of Education participates in the rate study and then reimburses under the COPS statute for educational services at residential treatment centers and residential treatment centers, yes, and PRTFs. Sorry, I had to go back to my Medicaid days. And BOCES, yes.
Okay, thanks. And one follow-up. When you're putting together the room and board rate study and you went across the board, did you look at all of just regional adjustments based on different costs in different areas and how that played out?
Chairman Senator Grew, yes. And that by creating the peer groups and then balancing out the reported administrative costs and the occupancy adjustments, it sort of leveled out, but it counted for everybody's geographic experience with costs for running businesses.
Thank you.
Okay, please proceed.
Okay, thank you, Mr. Chairman. More to come on that and another budget, but I think hopefully now you have some of the baseline information. Moving on to Budget Unit 5904, starting on page 54. This is the program policy budget for our child protection, adult protection, and juvenile justice services. This is where we manage the federal grants, and this is also includes some of our IT. You funded us to implement a new case management system to replace YCAPS. That system is called WyoSafe. It's on time, on budget. And we're very excited to start kicking off an intensive training period starting this spring to go live in September. So more to stay tuned on that over the course of the next few months. This budget also includes our adult protective services budget. As you know, there was a lot of time spent this summer talking about vulnerable adults and children with complex needs. This budget is funded with general fund. We do not get a whole lot of federal dollars for adult protective services. We did get some ARPA money and we're continuing to spend that. There's the potential for some federal dollars to come to us in about $100,000 pending the passage of Congress. But right now we're funded at $80,000 a biennium for adult protective services. This is also where we see our community juvenile service boards, and our central registry budget is in here as well. So moving on to the first exception request on page 57, priority number 7. This is the continuation of funding for the community juvenile service boards. This particular request has a little bit of a scattered past. In 2020, when we were faced with the budget reductions, the department did place this for full budget elimination on the list. So it was part of our budget reductions. The reasoning at that point is that it was 100% general fund and it had no match or no maintenance of effort. So they were dollars that could be reduced without a larger impact with federal monies. And we also, at that time, did not see statewide utilization of this program. We've seen it expand since. So the reduction at the time, again, made sense. It bothered us from the perspective of prevention and diversion, which is really important to the agency. However, in reductions, we just did what we had to do. What you saw then after that was a reintroduction of these funds, the $2 million put back into our budget with a note that said you must come back and ask for it again. So we are here. We have a list of questions that were submitted to us by you all to answer, and I'm going to pass that back to Lindsay and let her walk you through the changes that the program has made in the last couple of years and where we're headed.
Go ahead.
Before we go to Lindsay, I want to get the funding history accurate. I believe that you proposed in 2021 to eliminate it, but you had taken, this was funded about the same as your current request prior to the 2015-16 cuts. And then we cut it at that time down. And then this, in essence, almost restores it back to what it was prior to that. Am I getting that history accurate?
Mr. Chairman, Representative Larson, I believe that it was originally at 1.6 or so before the elimination of the budget. When in the 2022 biennium, it was funded at 2 million. So there was a little bit of a bump. This budget since 2016 has seen reductions. Again, it's general fund. It doesn't have any match or maintenance of effort. So when facing general fund reductions, this is one of the places that makes sense to go.
The court, I'm just curious, I'm looking at page 55, and I'm looking at your BFY 23. You received 18 million in federal funds on that. And can you just kind of walk us through what that was used for and how it was allocated?
Sure, Mr. Chairman. So
I
the
presume those are one-time ARPA dollars of some sort.
Mr. Chairman, these are ongoing grants that we receive from the federal government. So that's pretty consistent. Oh, the up to the $18 million, sorry. Yes, that was a lot of ARPA money that had come in. We saw a lot of support that came in from our child welfare, an increase in independent living monies, an increase in vouchers, a huge increase in adult protective services. And also, Mr. Chairman, it is our WyoSafe, our case management replacement.
Okay, thank you. Go ahead.
Thank you, Chairman. To speak to the community juvenile service boards, and just to recap, we received $2.2 million in 2022. 250,000 of that was made effective immediately to provide some stabilization to those boards who had faced complete elimination of funding June 30th of that same year. There were some conditions put around the funding in a budget footnote, so I would just like to speak to those. The appropriation enacted in 2022 allowed all of the community juvenile service boards active at the time to stabilize staffing and to continue to support prevention and diversion programs in their local counties. What we did immediately, July 1, 2022, was create a series of work groups to focus on servicing, to focus on data and outcomes, IT, data collection methodologies, and to bring forth a series of recommendations as part of that redesign. From the work of the project teams in 2022, there were a set of guiding principles agreed on by all participating community juvenile service boards, and the following recommendations were adopted. Community juvenile service boards, and I'll say CGSBs for short because it's quicker, should demonstrate a global alignment with Why Home Matters, which is our philosophical approach to prevention and diversion. CGSBs should focus on the delivery of evidence-based services. Work should continue to increase the consistency of single point of entry protocols at each county level. CGSB should clearly identify and document expected outcomes for each program funded. CGSB is needed to improve consistency and efficiency of data reporting through the adoption of either the Wyoming Survey and Analysis Center's reroute IT system or a similar data reporting system. As of July 1, 2023, state contracts were updated to implement all of these recommendations. The Wyoming Survey Analysis Center has continued to provide information and technical assistance on options for evidence-based service delivery for these contractors across the state. As of the data analysis that we conducted December 1 of 2023, 15 of 15 community juvenile service boards provided data requested through their contract. In addition to that, starting July 1, 2023, we actually onboarded 2 new community juvenile service boards in Niobrara and Platte counties. Considering the timing restrictions on the appropriation, if you'll recall, from July 22 to June 23, the focus was on stabilization and redesign of the programs. New contracts went into place July 2023, and those contracts are set to expire, as is the funding, July 30th of 2024. In terms of compliance with statutory requirements, they were required to submit basic demographic detail on juveniles. I will say that data received by the department is de-identified, but very specific in terms of county, program name, date of arrest, offense, disposition, arresting agency, court of jurisdiction, offense category, underlying jail term if it was provided, and recidivism level. I'm incredibly excited as a data person. We received 742 individual records for juveniles cited on or after July 1. Percentages were able to be calculated to produce initial baseline metrics. We can now break down those metrics by individual counties, but for purposes of just some initial data, I've aggregated it on a statewide basis. We know today from our community juvenile service boards, the top 5 offenses reported are traffic offenses, alcohol offenses, property offenses, drug offenses, and status offenses. We know the top 5 counties are Fremont County, Campbell County, Carbon County, Washakie, and Sheridan, noting that Natrona County data came in a little bit later, so I would presume they'd be in the top 5. Of the 742 individual records submitted, 46.5% were diverted from further court involvement. Only 23% went on to be adjudicated through the juvenile court system. From our perspective, this is the first instance where the department's been able to evaluate and establish consolidated baseline metrics, both at a county level and a statewide level. Diverted and dismissed offenses may be deemed cost offsets to the larger juvenile justice system. As we continue to get data, my hope is that we start producing county report cards and find mechanisms to share that information back with individual counties and programs. The data work group also had an opportunity to evaluate outcomes and more clearly articulate challenges related to collecting some of the data, specifically noted in the budget footnote, educational related data. It's not a common metric collected through the boards, so we continue to work on that information. But we are positioned well with the 15 community juvenile service boards to continue to develop strategies to bolster the data collected and increase the sophistication of our reporting. But this is the first time since I've been with DFS that we had well-defined statewide, at least from the 15 participating boards, outcomes data to share.
So I wonder who's going to get those report cards and who's going to be responsible for them. Okay, interesting. Okay, please proceed.
Okay, Mr. Chairman, moving on to the next exception request. It's on page 57, priority number 13. This is to increase federal funding of the federal spending authority for the maternal, infant, and early childhood home visitation grant. So a few years ago, we applied for what we call the MICV grant. It is a home visitation service. We contract with providers to serve a couple of the counties. We're expecting an increase in federal funds will expand that reach, but it's using a model called Parents as Teachers. As you know, we provide TANF funding to the Department of Health, which in turn funds maternal and child health services in local communities through their public health nurses. They use a model of home visitation that involves a nurse. This is a complement to that program, kind of gets at a bigger audience with using parents, lay people, and helping, and those people then go work with families in need, families who qualify to provide parenting assistance. This has not been in our, this has not been in our budget, correct? This is new. So this was something that we had been B11ing in. We felt like it was time to bring it into the budget. It's consistent. And so it's just recognizing the authority in the program officially.
And so Corin, you suggested that this funding may be increasing over time?
Mr. Chairman, yes, depending on federal authority, there's always anticipation of this particular fund increasing. But as we know with Congress, sometimes that's hard to
Kevin, go ahead.
tell.
Mr. Chairman, we concur, and over the last 3 biennium, in fact, on your B11, you'll see a checkbox that says, does this B11 meet the requirements for a exception request or a candidate for exception request? So throughout the budgets, you'll see many of these items where we are trying to see that the funds get appropriated to limit the amount of B11s that we have, so you have an understanding of the federal funds. So this would be one of those candidates.
Okay, seeing no questions, please proceed.
Hey, Mr. Chairman, moving on to page 59, Unit 5904, again, an increase in federal fund spending authority. This is just putting the authority in the right place so that we can make the proper transactions.
Okay, proceed.
Moving on to budget 5908, the Wyoming Children's Trust Fund on page 62, there is an exception request. I believe the chairman of the board is here to explain this exception request. Just a quick note, however, the money that was requested in this exception request was to fund a reclassification of a position. The position, when we had submitted the budget request, was anticipated to go from a business office coordinator 1 to a business office supervisor 10. In the meantime, ANI has submitted their decision on what the reclassification should be. It has been noted as what is called an SOSP 09. It's a social services policy position. And so there will be a decrease to this request if it is funded.
Okay, any questions on that?
Mr. Chairman,
Representative Stiff.
Director Schmidt, I thought you said that if this is approved, there will be a decrease in the amount. So what will the amount be?
Mr. Chairman, based on ANI and the tables, the minimum would be $5,009. And I should have done the math. I didn't do the math. Oh, okay, excuse me. Mr. Chairman, Representative Stiff, the increase would be $28,015.
Mr. Chairman,
Rather, Mr.
Go ahead.
I apologize for interrupting. We're
Mr. Chairman, let me state that again because that didn't come out very well. The request right now is for $44,000. The amount would be decreased to $28,015.
So that's the chart on page 65, the 44.4, right?
Correct.
And it goes down to 28.
And Mr. Chairman, follow up.
Go ahead.
Director Schmidt, I was reading the narrative here of the change in expanded duties. Can you describe with a little more specificity what that means? How is this person's job different than, say, what they got hired to do?
Mr. Chairman, Representative Stith, if I may, I'd like to ask Chuck Kratz, who is the president of this board, to speak to the changes. A little bit of background information on this particular fund. It has been brought into our budget and we have fiduciary oversight, but we have no programmatic oversight. It is a board appointed by the governor and it's through them that they direct the operations of this particular fund. We just merely make sure that the budget is okay. Also, one note in your summary document, there's an explanation of the budget request on page 2 at the bottom. And that's where you see that $28,000 just for future reference.
So Don, can we just make sure that when we walk through the budget, we got it? Okay. So is there any other questions on this? I don't know if we need Chuck to kick in. I think we're okay with it. Unless you want to, go ahead. Welcome. Good to see you.
Bush. Mr. Chairman, basically, we had hired additional staff in 2020, November, and looked at more of a business function, managing grant fiscally and working with DFS's staff around sorting through some grant problems we'd had in the past and getting that worked out. And then when we routinely reevaluated the position and met with A&I, we went through their job questionnaire at a meeting with them and found that the staff position was actually more related to social services analyst at 60% to 65% of the time, and the remaining being more in the business area. And so, you know, we went through the job description questionnaire and calculated the percentage of time on each activity and those types of things. And that's where we left it with A&I, and then they came back to us with the appropriate job classification.
Okay, questions for Chuck? Go ahead.
Mr. Chairman, just privilege, just want to, Mr. Kratz and Laura Davison, who's here with him, have spent their adult lives in Lander dedicated to children and youth, drug courts, and establishing policy that this state now has in place. And I'd just like to say thank you, Chuck, and wish Laura was here in the room. Your influence has been very positive for the state, and we appreciate that.
Well, thank you.
Okay, please proceed.
Mr. Chairman, moving on to
Chairman.
page,
Sorry to interrupt, but can we go back to page 60, please?
We are. That's page 60.
On maintenance agreements, 292, there was a House Bill 0037 in 2022 that required $100,000 for maintenance. That is not in the standard budget. It should have been placed in the standard budget. Am I correct? Yes.
They're shaking their heads, yes.
So please add $100,000 to the standard budget for software maintenance per House Bill 0037.
Okay, Don, you got that? All right, let's go. Now we're back. All right, let's just see if we can move a little quicker on the ones that aren't going to be controversial so we can get through this.
okay, Mr. Chairman, and thank you, Kevin, for that. Moving on to the SNAP budget, which is 5910, starting on page 69. Did I? Yeah. I'm good, right? Page 69. There's one exception request in this budget that starts on page 70. And this is for real-time employment and income verification tool for SNAP eligibility. This is real-time. We call a number, we call it the work number. They tell us if a person's employed and they tell us how much they're making. We actually use this service across a lot of programs, but the cost has increased substantially. And so now we're asking for an exception request to continue to pay for it. Child support also uses it, but they have enough money in their budget to cover their particular costs. This is a fraud detection tool. For the experience just a couple weeks ago in one of our offices, a client was wanting us to move the paperwork very quickly. We paused, we called the work program. That person was employed. The paperwork that he submitted said he was not. So having access to that data quickly is important. It really does fend off a lot of potential fraud. We also know that we also recognize that getting the fraud before it starts is a lot easier than finding it and recapturing those costs afterward. So this is an important tool to us.
So is this a one-time funding, or is it an upgrade, or is it continual maintenance?
Mr. Chairman, this is continual. This will be an ongoing cost. I do expect to see increased costs. There's only one vendor in the US that provides this service, so we're a little over the barrel. I know the feds are trying to develop other competitors or encourage other competitors, but for right now, we pay what we pay. I do have to say that Christy gets in there and battles with them, and so we've been able in the past to see some decreased costs, but now this is the rate that we'll have to pay.
So what's the full biennial rate with this addition for this service?
The full cost for the biennium across all the programs, I don't know that. Do you know that, Christy?
You can just get it for us. Okay, go ahead.
Moving into the child support budget, budget unit 5911. On page 74, we have two exception requests. The first one starts on page 75. This is an increase in filing fees per the 2023 general session when the legislature approved an increase in the filing fees. Our child support program pays about 25% of the filing fees.
We accept both.
Okay, good.
Go ahead.
Thank you, Mr. Chairman. Mr. Chairman, the next exception request on page 77 is again a revenue adjustment, just a budget fix.
Okay.
Moving on to unit 5912. We have two exception requests starting on page 80. The first exception request starts on page 81, and this is the Early Childhood Integrated Data System. Mr. Chairman, I know there was some conversation last Friday about this particular system, as there was a request that showed up in the county or the college commission budget. And I want to give a little bit of context and background as to how we got to this particular exception request and why they showed up in two budgets. The project of SLEDS, the statewide longitudinal educational data system, has been going for quite some time, as I'm sure Director Caldwell mentioned. We were invited, the Department of Family Services was invited into that conversation primarily because of the data that we collect on our child welfare population and our juvenile justice population. So as part of the SLEDS data, there's subgroups that we serve that educational outcome is very important. We know kids in custody, kids that are involved in our system, oftentimes have worse educational attainment than other populations. So we were invited to start participating in that overall process. I'm a member of the SLEDS e-board, which makes decisions about what the research questions are and overall, what is it that longitudinal educational data set is looking at. We have not been able to integrate our data into that system yet. Next session, you're going to see a request for us to look at our confidentiality statutes because right now they're a little prohibitive in being able to share data, but that's a different conversation. So that's how Department of Family Services came into the conversation with SLEDS. At the same time, the preschool development grant was started in 2020. And that was a grant that originally was provided to Align. So
Go ahead.
Aligned by title, aligned by verbiage. What is aligned?
So, Mr. Chairman, Representative Larson, Align is a nonprofit company that provides a lot of services statewide. At the time that that grant was applied for, Align was actually the grantee. They received directly from the federal government the preschool development grant dollars. Those dollars were overseen by a steering committee and managed strictly by Align. There were decisions that were made at the very beginning of the grant process, one of which included an early childhood integrated data system. It was part of the original thinking for the federal grant and was incorporated into all of the grant applications. The following year, the federal government said, we don't want to send our money directly to a nonprofit. We want this money to go to a state agency. So we became then the state agency that was the fiscal agent for the PDG grant, the Preschool Development Grant. So we in turn, following the spirit of the original grant, passed that money through to Align, and that's the current arrangement today. That grant is ending. However, the effort that was started with the Early Childhood Integrated Data Set has been an important effort. And so as the grant has been coming to a close, we've been discussing a lot about the sustainability of those efforts. And the sustainability of the Early Childhood Integrated Data System is important to the agency, and I think is really important to the ongoing conversation around early childhood. What we know from the data that's already in there that we've been submitting comes around access to child care throughout the whole state. What's coming into the system will be educational data and early education and prevention data, or EIEP, early intervention education programs, Part B, Part C, in the Department of Health budget. With the integration of all that data into one place, we really can do a much better job of understanding what our childcare situation is like, potentially what our educational outcomes can be as we lead into the K through 12 system. But more importantly, to really understand as we continue to struggle economically with childcare, who's getting it, who's not, what's supported through other types of funding, like the TANF money that goes to the preschools through the Department of Education, Title I preschools, just overall the view of what early care and education looks like. We do not want to interrupt that process. And so sustainability really then kind of came at us in two ways. One is to continue the contract that we already have for the system. We already have the data's already in there and is continuing to be added. That is the request that's in our budget. There's also an opportunity through SLEDs to at some point integrate that data into SLEDs. But SLEDs is not yet ready for the integration of that data. So we're in this weird space right now where we have a system, it's up and running, there's data in it, it can answer a lot of the questions that we have as an agency, and certainly that will continue to expand to the early education conversation. But we also have the SLEDs data that will continue to grow and continue to then become more robust. What this request is to continue the funding for the next biennium. And during the course of those 2 years, then really coming up with a reasonable sustainability plan that may or may not include SLEDs, but certainly will continue to provide us the early care and education data that we've all kind of wanted in this space for quite some time.
Question? Representative Stitt.
Mr. Chairman, Director Schmidt, so for example, is the goal then to have answers to questions like, if I go to preschool, am I more likely to graduate from high school? If I go to preschool, am I more likely to know how to read things? Is that part of the goal of this whole thing at the end of the day?
Mr. Chairman, Representative Stitt, yes, and then some. I mean, the potential, there's a lot of potential here, but it's kind of a chicken and an egg thing. We have to get the data in, start to answer the questions. Then when more questions come up, go out and get more data. What we know is that if children are reading by third grade, their chances of educational success increase substantially. What we know from an agency standpoint is many of our kids are struggling to read in third grade. So by starting at that third grade and working backward, it'll help us to identify what are some of the system changes that maybe need to occur in order for those kids to come to school a little bit more prepared through the educational systems we already have, TANF preschools, the early education program at the Department of Health, and certainly whatever work we can do to connect our kids. And when I say our, I mean those children that we serve through child care assistance or those children that are receiving services because of child welfare needs.
Representative Larson?
Thank you, Mr. Chairman. And Director Schmidt, we've tried to sort through this because we don't argue the importance of the data and what it could, the benefits of that. But procedurally, it's a little wonky. And so as I understand it, your agency did not apply for the grant originally, but you inherited it by virtue of federal regulations. So now the grant's coming to an end. And you're saying you're going to continue the contract to provide data, but is this going to have an RFP? Because the contract's ending and you weren't the original requester of the grant. And so it would appear to me that there would be a process to send out an RFP to get that information. And so if you can walk me through that, if the plan is somebody's going to do a sole source and help us to understand why we would do that. Then you made a comment that was really made my ears come forward a little bit when you said moving forward, the request is for this biennium. So we understand that maybe go through this biennium and continue to collect data. But then moving forward, you say may or may not include SLED. That's very concerning because we've made a policy decision that SLED is going to integrate all of that educational standards. And it gives me pause to think that now we could start funding and bifurcate that effort into another contract that at some point we're going to have to figure out. So am I seeing that accurately?
Mr. Chairman, Representative Larson, so to answer your first question first, yes, we inherited the grant. It was submitted and awarded to Align, as I mentioned, and then we inherited the grant. What we didn't inherit, though, were the contracts that were issued by Align in order to pay for the services from the grant, of which one is with the current vendor for the eKids system. So we do not have the contract with eKids. That arrangement was made through the first origination of the grant. That is a little bit problematic when bringing it into the fold of state government. So it is something then in a typical situation, you know, we would have probably submitted a request for proposal, had those come back in per our procurement laws and rules. With it coming back in this way, it is a little bit awkward. I think what the policy decision would be is to request a sole source through a budget exception or a BEA. Bid exception reapproval, thank you. Which then says, here's the justification we would have for doing a sole source. The justification in this particular situation would be is that it's an existing contract and an existing system. We want to just give it a shot for a couple more years, and then we will then make a more sustainable conversation, which then brings us to the second question about SLEDs. Sustainability can occur in two ways. We can continue with the contract for ESIDS as is in perpetuity. We could always be able to bid out, award to vendors who provide this kind of service. The requirement, though, will have to come that that data can be integrated or shared across with SLEDS. So two different systems, SLEDS has some data, ESIDS has other data, and then that data can be shared and analyzed. That's one approach. Another approach is that SLEDS then gets developed in a way then that they get all the data. So there's no integration from one system to another. It would go directly from the data that we collect into SLEDS. That's the conversation that needs to occur over the next 2 years, is where does that data, the data lives with the agencies, but where does it go to get analyzed? Where does it go to be then captured? And that's what we don't know yet. And I think the 2 years will give us more opportunity to develop a more robust SLEDS that's contemplating the early care and education data, at the same time not lose any momentum with the contract that we have, the efforts that we have to give us that opportunity. SLEDS had not contemplated eKids before we started to talk about sustainability. And when sustainability became part of the conversation, then that's where SLEDS then became a potential option. It's just not quite there yet to continue right now or in time for the contract to end.
Okay, it's 10 o'clock. We'll take a 15-minute break. We'll be back at 10:50. Hmm?
Should be back in a minute.
Tell a joke. Yeah. You could sing. Join the crew downstairs. We are at page 82. Please proceed.
Thank you, Mr. Chairman, and I very much appreciated the break. Okay, so on page 82, Unit 5912, we have an exception request, and this is a federal authority fix. A couple of years ago, we got a pretty good increase in our block grant for child care development, and this is just now to accurately represent